We have Minister Begitele, we have Minister Ronald Lamula. We will also be welcoming Minister Zwelim Kize, who's just wrapping up a meeting with unions. Of course, we also welcome to the message from government. Having said that, without any further ado, let's start with Minister Nkosazana Dlamini Zuma. Unless Nangaba, you've got something that you want to alert us of.
Yes, please, Minister. My profound apologies. We've just been informed that, okay, no, we are now live. I just wanted us to do a countdown, but we are now live. Thank you, Minister.
Thank you very much. Ma'am Nkosazana Dlamini Zuma, the platform is yours, ma'am.
Thank you very much, Minister Mthembu, our program director here, colleagues, Minister Cele, Minister Lamula, and Minister Mkhize, and all the members of the media and compatriots. Indeed, it's been 9 months since our nation and the world has been engulfed in the coronavirus. Never has been the global economy and healthcare systems been this challenged and overstretched. Today, we solemnly gather to confirm the misery and unpredictability of the virus as we elaborate on the added measures introduced by the President and Cabinet, which are meant to combat the spread and fatalities caused by the virus. Indeed, time and again, as has been done by the President, last night, the President warned us of the dangers of the coronavirus. And he warned us that we have to stick to the health protocols, we must change our behavior, and that we can actually defeat this virus if we all collectively do what we've done before, especially during the first lockdown,
Minister,
where we were able
bit,
to...
Please. Can I disturb a bit? My apologies.
Yes.
We are asked to remove our masks so
Yes.
that the deaf people can read our lips. They are saying with us wearing the masks, they are
Okay.
to follow. My sincere apology, Minister.
Okay. Okay. No, I will do that for the deaf people. Just that some people have said we always say they must wear masks, but we talk without wearing our masks.
Yeah.
Thank you, Minister Mthembu. We just want to say that the President was reminding us that collectively and individually, if we behave and make sure that the health protocols are kept, we can actually defeat this virus. And therefore, it's important for all of us to ensure that that happens. Unfortunately, sometimes, especially now with the festive season, we've kind of lowered our guard, and many people were not wearing their masks, and social distancing and partying and so on. But I think now with over 1 million of our people having had the virus and more than 26,000 deaths, I think we should take this very seriously. And our condolences to all those that have passed away, and those that are in hospital, we wish them a speedy recovery. Let me just say that these regulations are not really new. As the president said, it's adjusted level 3. So we've been here before in many ways. One, just to clarify that the curfew now starts at 9 p.m., 2100 hours to 6 a.m., which means during that time, all of us should be at home except those who are working, or if you have an emergency, as the president said, whether it's a security or medical emergency, but otherwise we should be home. And this is because the virus does not move. It is moved by us. The more we move, the more the possibility of the virus to move. And when we are at home, we must sanitize. When we are with people that are not from the same households, it's also useful to wear a mask, even if you are at home. Because when people come in and out, you don't know where they've come from. You don't know whether they are asymptomatic with the virus. So it's important to wear the mask when you are at home and when you are in public. But at home, it's useful when you are meeting with people that you are not living in the same household with. Now, what is different this time is that wearing a mask is now mandatory. You have to wear a mask. If you are not wearing a mask, you are committing an offense. You could be fined, you could be sent to prison, not for longer than 6 months. So it is important to wear a mask. And wearing a mask is not just protecting yourself, but you're protecting your loved ones and everybody else. So no one is safe until we are all safe. So we must all wear the mask and protect each other and one another. That's what experience has taught us, and we must stick to that. And the government does not want to arrest anyone, doesn't want to take anyone to prison. So please just wear your mask and there'll be no problem. The police won't do anything. You won't have a threat of going to prison or being fined. Just wear your mask. So it's not the aim of the government to be taking people to prison, but we're just trying to say, let's protect one another. So that's the mask. And the curfew as well. It's very important to observe the curfew. If you are on the road, it should be because you have a permit, you are going to work, or you are from work, or you have an emergency. The same will happen. The police can arrest you, you can be fined, you can go to prison, but the government does not want to take anyone to prison. It just wants us to be safe. So please observe the curfew. Then when it comes to funerals, which is one gathering, so one gathering that is allowed. We were at 100 before, 100 people in the funeral, but now we have to be 50 with sitting 1.5 meters apart. But if the venue where you are cannot take 50 people 1.5 meters apart, it means you have to be less. You have to then be half the capacity of the venue. And at the funeral, everyone have to wear a mask. Please wear your mask, sanitize, social distance. And we're urging that at the funeral, the funeral should not take more than 2 hours. It can take less, but it should not take more than 2 hours. Still, night vigils are not allowed. After tears and gatherings after funerals are not allowed. And this is because also funerals are super spreaders, because people tend to sing, sometimes they hug and so on. So the shorter the service, the better. And the president did say that social gatherings are prohibited for 2 weeks. And then after that, it will be reviewed. But people can still go to restaurants. They can still go to casinos. They can still go to those places, but libraries, they can still go to archives, galleries. It's all in the regulations, but they have to be 50 maximum inside. Whether it's a restaurant, whether it's a library, whether it's a gallery, they have to be 50 inside, sit 1.5 meters apart. If that place is too small to take 1.5 meters apart, 50 people, then it has to be half the capacity of the venue. So it's very important. And outdoors, it can be 100 if a restaurant has outdoor seating, but it has to be, according to the health protocols, 1.5 meters apart and with a mask unless you are eating or drinking. It's very important that we keep to those. And then cinemas are the same. You can still go to the cinema or theater, but keeping to those protocols. Now, we come to the issue of the beaches. The beaches are closed in the Western Cape, in the Eastern Cape, in KZN. They are closed for everything. Except fishermen, but otherwise it's closed. They are closed. In the Northern Cape, because the Northern Cape is not yet a hotspot, they will be allowed. So beaches will be open there. But if it becomes a hotspot, even there, they will be closed. So Northern Cape is the only place where people can still go to the beach. Sports fields and sports grounds, nobody should be there except for professional sporting events. Those are the only venues that will be allowed for professional sporting events with no spectators. Public parks are also, and recreational facilities are also closed, except the botanic gardens, aquariums, game parks, zoos. Those will be open from 9 to 1800 hours. And they must observe all the health protocols, and they cannot take more than 50 people at a time. If it's indoors, like aquaria are indoors, but outdoors, it can be 100 people. Hotels restaurant, hotels, lodges, B&Bs, and those kind of accommodation, those are open because people are in their rooms. So those are open and they can be filled to capacity. But in the public spaces, like restaurants, any public space, they have to observe the health protocols, 1.5 meters apart, and wearing of masks, and making sure they sanitize. And of course, if it's outdoors, it's 100 with the same conditions, 1.5 meters apart and wearing a mask. These are very important because health has advised us, all of us, that huge gatherings, crowds are a problem. In the churches, if possible, to use instruments and to use soloists rather than everybody singing, because people tend to take off their masks when they are singing. It would be helpful if we observe that. And then when it comes to alcohol, I think the president explained a lot about alcohol. Liquor cannot be sold for on-site consumption or off-site consumption. You cannot buy or sell liquor. Transportation of liquor is only allowed if it's going for export or if the manufacturer is transporting it to the storage, or if it's alcohol that is used in industry. But otherwise, if it's liquor that we drink, we're not supposed to transport it. We're not supposed to distribute it. So that is just not allowed. And that is for 2 weeks. And then after that, there'll be review. But for now, it's just for 2 weeks. So those are and then the initiation schools that were opened in the Eastern Cape. You'll recall that they were open in the Eastern Cape, except in Nelson Mandela and Sarah Baartman. Now they all have to be closed. It's no longer allowed. The only thing that will be allowed is for those who are already in the initiation school to come out, complete their initiation, but no new initiates are supposed to go into initiation school. Only those who are already in there should complete. So it is now prohibited. As those who are in must complete. Imigidi and all the celebrations that take place after initiation are prohibited. Those can be done later because of the situation that is very grave. The hospitals, as the Minister of Health will explain, are stretched to capacity. People are dying, even mortuaries. And that's why, for instance, health will probably say that people should bury within 5 days so that the mortuaries do not get full. So it is a very grave situation, and we must really look after ourselves. And we must take vitamins, boost our immune system. There is no cure. So we should just really try and look after ourselves. In terms of international travel, nothing has changed. All the borders that were open will still be open, except the 33 that are closed. Kosi Bay is now, from the 1st of January, will be open. And the public transport, taxis, nothing has changed, but the masks are compulsory. In the taxis, in the buses, in the trains, masks must be worn. So maybe I'll just now ngithi ukushwanqathela nje kancane ngesizulu ukuthi njengoba umongameli izolo bekhuluma kabanzi esixwayisa ngokuthi lesifo sesibhebhetheka kakhulu, sibulala abantu abaningi, izibhedlela ziyagcwala, abantu bayashiya emhlabeni. Siyacelwa kakhulu ukuthi silandele imigomo, silandele imithetho yokuthi isivikele, ngoba akekho ophephile uma omunye engaphephile. Uma eminye efakile imask omunye engayifakile kuyinkinga, ngoba lo ongayifakile imask uzolifafaza igciwane abantu balithole. So kubalekile ukuthi siqhube senze njengoba sasenza, sifake izifonyo. Mawuphuma nje kwakho ufake isifonyo. Kanti noma ukhona endlini, uma kufika abantu eningahlali nabo, kungcono ukuthi nizifake izifonyo. Kodwa nje mawuphumile isifonyo siyafakwa, noma ngabe uya e-mall noma ngabe uya kuphi, isifonyo kufanele sifakwe. Okuhlukileke manje ukuthi uma ungasifakile isifonyo, amaphoyisa asenelungelo lokukubopha noma lokukunika i-fine noma uye ejele ngempela. So kubalekile nokuthi-ke kufanele ukuthi sihlale emakhaya kusukela ngo-9 ebusuku kuze kube u-6 ekuseni. Uma ungahlala ekhaya utholakala usemgaqweni ngo-9, after 9, kufanele ukuthi kube ukuthi unemvume ngoba uye emsebenzini noma uphuma emsebenzini, noma kube ukuthi unesimo esiphuthumayo, mhlambe khona ogulayo, mhlambe khona ingozi. Lokho kubalekile ngoba uma ungakwenzi amaphoyisa asenelungelo lokukubopha. Kodwa uhulumeni akajahe kubopha umuntu, akafune kubopha umuntu. Uhulumeni uzama nje ukuthi siphephe. Ekuphepheni kwethu siphephise nabanye. Ngakho-ke asifuni nje ukuthi amajele agcwale, ama-police station agcwale, ngoba sifuna abantu bawagqoka ama-mask. Mawuzigqokela i-mask, iphoyisa lizokuhlupha lutho. Mawuziyela ekhaya, ufike ekhaya u-9 akushayela ususe ekhaya, iphoyisa lizokuhlupha lutho. Okunye-ke futhi inhlangano noma imicimbi ayisavumelekile nje kulamaviki kulamasonto amabili esikuwona ezayo. Kobuye kubhekwe-ke emva kwamasonto amabili ukuthi isimo sinjani. Kodwa kwamanje kulamasonto amabili nje imicimbi yonke ivaliwe. Into nje ewumcimbi wokuzijabulisa ivaliwe. Into evumelekile imingcwabo. Nayo imingcwabo sesibuyele kulewa 50 abantu. Akusolona ikhulu njengoba bese kunjalo. Siyacela-ke ngempela ukuthi nikugcine lokho, ngoba imingcwabo iyona indawo ukutholakala ukuthi lesifo sibhebhetheka kalula, ngoba abantu basuke bendawonye, kwesinye isikhathi becula, kube inkinga-ke bathole lesifo, bathi kade bezo emngcwabeni kuphinde kudaleke eminye imingcwabo. Siyacela kakhulu ukuthi imilindelo iqhubeke ingabi khona. Emva komngcwabo kuphele kuhlukana abantu baye emakhaya, kungabi khona imicimbi emva komngcwabo. Naloku-ke mina engakaze ngikwazi kahle ukuthi kusho ukuthini lokho kuthiwa after 2 years abantu bayojabula, kuthiwa after 2 years. Okwamanje-ke kuvaliwe nako. Futhi imingcwabo siyacela ukuthi esontweni noma kwi-service kungathathi kudlule ema-aweni amabili. Kungaba ngaphansi kodwa kungadlule ema-aweni amabili. Siyacela-ke futhi ukuthi uma abantu kufuneka bangcwabe, mhlambe bangahlalisi umuntu ukuze kudlule iy'nsuku ey'nhlanu ngoba abasemamochwari sebeyakhononda ukuthi kuyagcwala manje. Kodwa-ke ngiyagcizelela ukuthi imicimbi ayisavunyelwe. Into ezivunyelwe ezisahlanganisa abantu ukuthi mhlambe mabeya la kudliwa khona noma beye e-library la beyobheka iy'ncwadi noma beyobheka amafilimu emasinema nasema-theatre. Kodwa nakhona fanele bangabi ngaphezu kwama50 behlukene igxathi nohafu. Imitha nohafu funeka bahlukane bangasondelani bafaka izifonyo. Okubalekile futhi esifuna ukuphawula kakhulu iloko okuhambisana notshwala. Ukuthi utshwala abusathengiswa nje indawo lamasonto amabili. Awubuthengi, awuhlali futhi uye eshibhini noma ethaveni kuvaliwe. Nje utshwala nje abusaphuzwa nje endaweni e-public noma kuse-restaurant noma kukuphi utshwala abusafuneki lamasonto amabili ngoba utshwala siyazi ukuthi benzani, ubanga iy'ngozi, abantu bayalimazana, kusho ukuthi kwanda abantu abaye ey'bhedlela. Kanti iy'bhedlela zethu seziyagcwala kakhulu. Siyacela-ke ngempela ukuthi utshwala kesime nje impela, kesime buyinkinga. Ngoba futhi benza ukuthi sikhohlwe nokufaka iy'fonyo mase sibukhile. Asibesazifaka iy'fonyo sesiyazingcebelekela nje sesikhohliwe. Sesiyasondelana futhi abantu abaphuzile bayathanda ukusondela nje. Siyacela ngempela nje ibalekile leyo tshwala. Kuthi futhi akufanelanga kutholakala ebhuthini yakho kunotshwala noma emotweni behliswa benyusa utshwala. Phela utshwala obuzotholakala busemgaqweni, utshwala obuya for ukuthi buphumele ngaphandle emazweni angaphandle buyothengiswa export. Noma i-alcohol eya emafemini eyokwenza ama-sanitizer, eyokwenza nezinye izinto ezenziwa nge-alcohol. Kodwa nje thina akufanelanga ukuthi sitholakale siphethe utshwala sibehlisa sibenyusa. Konke lokho kwenzelwa nje ukuthi kuphephiswe iy'mpilo zethu. Kodwa-ke ukuhamba uye phesheya noma uye kwamanye amazwe esisondelene nawo kusavunyelwe, kodwa imithetho yezempilo iyagcinwa, ube nesitifiketi ukukhombisa ukuthi awunalo igciwane, awunayo i-COVID. Namabhoda lawa kade evuliwe asavuliwe, avaliwe asavaliwe. Siyacela-ke kakhulu futhi ematekisini ngoba ematekisini abantu bayasondelana, ayikho enye indlela kufana nasemotweni. Kodwa siyacela ukuthi ama-mask noma ikanjani afakwe ukuze siphephisane kusulwe nezandla nge-sanitizer. Kodwa nje isifonyo ematekisini nayo nasemabhasini nasey'timeleni kubaluleke ngale ndlela. Siyacela-ke ukuthi njengoba kuyisikhathi sakhisimusi futhi ke sizame nje ukuthi kulesikhathi singenzi amaphathi nasemakhaya azokwenza ukuthi abantu babe baningi basondelane bakhohlwe ukufaka iy'fonyo, gcina iphathi seyidala umngcwabo. Kanti bekufanele kujatshulwe kodwa emva kwamaviki amabili kube sekudaleka umngcwabo ngoba sekuthelelwene ngale sifo. Siyacela-ke sibonge futhi ngoba siyazi ukuthi abanye ngempela bayazigcina bayayigcina lemithetho. Ekuyigcineni kwabo kwenza ukuthi sonke siphephe ngoba akekho ophephile yedwa abanye bengaphephile. Siphepha ngoba sonke siphephile. Siceleke impela nje kakhulu ngoba izibhedlela noko seyidonsa kanzima. Abantu abasebenza kwezempilo badonsa kanzima. Ake sibazwele, ake sibacabangele ukuthi senze okufanele sikwenze ukuze nabo labesebenza khona bangahlukumezeki. Thina sesicwele bengasazi bazosenze njani. Nabo sebetheleleka sebegula. Siyacela-ke nje. Ngingathi okwamanje ake ngime lapho Baba Mthembu. Ngiyabonga.
Sibonga kakhulu, Minister Dlamini Zuma. Thank you very much. We now will give an opportunity to the Minister of Health to speak to us. Kabazela. Unmute Kabazela. Unmute ba. Thank you.
Thank you. I'm sorry. Bengingaboni ukuthi ngisazivalile. Kodwa ke ngizofisa ukuqhubeka lapho ukugcina khona umhlonishwa uMama Dlamini Zuma ukuthi siyacela kakhulu ukuthi umphakathi ukuthathele phezulu ukumbiko obekwe umongameli ngokuthi lesimo siyaphuma kakhulu esandleni njengamanje. Siphuma ngale ndlela yenza ukuthi siqala ukwethuka ukuthi izibhedlela zizogcwala kakhulu ngaphezulu kwento ebiyenzeke ngalesikhathi sesiwombe sokuqala sangoJune, July, August. Lokho sikubona kuyinkinga kakhulu ngoba kusho ukuthi ukugcwala kwezibhedlela kulapho sithembele khona sonke. Njengamanje ke izibhedlela eziningi ezi-private zigcwele. Sekunabantu abaningi okudinga abasuke ezibhedlela ezi-private baye kulezi kahulumeni. Kodwa masibuka sibona ngazuthi kusekuqala kwendaba lokho. Sekuzoba kugcwala ke manje kakhulu kulezi kahulumeni izibhedlela. Kodwa excuse me, kodwa into ebalulekile kuthina ukuthi ziningi izinto okufanele sizilandele ngalesi sifo. Okubaluleke kakhulu ukuziphatha ukuthi ukuvala umlomo namakhala ngesifonyo imask kubalulekile uma ngabe uhamba ematekisini nasemabhasini. Funa kube khona indlela ukuthi amafasitela avulwe kancane ukuze umoya ungene uphume ungahlali ndawonye ngoba isikutu leso isona esenza ukuthi abantu batheleleke kakhulu. Kuzobaluleka ukuthi abantu bazi futhi ukuthi konke lokho kusezandleni zabo ngoba lapho la uthinta khona uzobe kuthinta omunye umuntu okade mhlawumbe enegciwane. Ngakho-ke ukuthi ugeze izandla noma ufake isanitizer kubalulekile ukuthi kuzonciphisa ukuthi isifo singabuyeli kuwena. Kuba kuvakashelwana nje izitsha eziningi, amaplate, amasosa, izipuni, konke lokho kunethuba lokuthi ngadlulisela isifo. Ngakho kubalulekile ukuthi sigade zonke lezo zinto kakhulukazi uma kusemcimbini. Thola ukuthi abantu bayakha ukudla bakha ngesipuni esisodwa lapho la bephaka khona beshintshane ngezandla. Uthola omunye mesenaso nabanye bazokuthola. Kubalulekile ukusikwazi lokho. Enye into ebalulekile futhi ukuthi uma usutholakala ukuthi unalo igciwane cela ukuthi uhloniphe imigomo ebekiwe ukuthi umuntu ahlale ekhaya lezo nsuku ezifanele. Kufanele kube ishumi lensuku noma ngabe unalo igciwane noma ngabe unalo. Uma kuthiwa uya ku-quarantine senzela ukuthi kubonakale noma usunegciwane ungalidlulisela kwabanye abantu. Sesinamandla kakhulu lesifo ngakho ufuna sikusukumele kakhulu. Kodwa siyanxusa kakhulu kulabo abasha ukuthi ibona isikhathi esiningi abahamba indawo eziningi ezinabantu nemimoya enabantu abanegciwane. Mase bebuya beze emakhaya bafica abadala behleli kade bengayanga ndawo bagula umuntu kade engazange aphume endlini. Konke lokho sikubona kuyinto efuna ukusukunyana. Into esesiyicela njengoba kuze kwaphuma isinqumo sokuthi ake kumiswe ukuthengiswa kotshwala ukuthi ziyagcwala izibhedlela. Into esihlupha ngotshwala-ke seyichazile udokotela uDlamini Zuma ukuthi into ehlupha ngotshwala ukuthi abantu basuke bangakwazi ukukhumbula ukuzigada nokuthi bame kude nabantu ukuze bangangenwa yilesi sifo. Kodwa inkinga yangempela into egcwalisa ezibhedlela njengamanje abantu abalimele, abantu abalimazene, abalinyazwe zimoto, iningi labo leyo nto leyo yenziwa utshwala. Ngaleyo ndlela kulezi insuku zobumnandi abantu abalali. Kungakho sithe kungcono ke kube nomthetho othi ake kumiwe kube khona isikhathi la sithi wonke umuntu akabe sendlini abesekhaya kwenzela ukuthi kuzoncipha abantu abazolinyazwa iy'moto balimazane emgaqweni. Leyo nto leyo ibaluleka manje ngoba vele kugcwala esibhedlela, ufika ne-COVID ula, nofika nophayo olimele ula. Manje mangabe bonke labo bantu belapho akusakwazi ukuthi sinake labo uyibona kufanele siyakwazi ukubasiza abangakwazi ukwenza lutho uma sifo sesibangenile. Yilo nto-ke siyibona ibalulekile-ke ngodaba lokumiswa kotshwala. Kukhona lolu hlelo-ke lolu daba esandulukhuluma-ke oluthinta ngokuthi kunale gciwane elithanda ukushintshashintsha kancane silibiza i-variant. Lokho kushintsha kwalo sikadile njengamanje ukuthi kungasinikezi inkinga, kodwa into enkulu yokuthi zonke lezi zinto esizenzayo ziyasebenza nakule variant entsha. Kodwa into enkulu yokuthi akufanele siziyekelele ngoba uma kukhona okusha okucacile le variant legciwane eselithanda ukushintsha linakho sekuyosithinta manje sekusigulisa kakhulu, kanti uba besizozigada besizophatha nalo njengaloba kade senza kule COVID ebesinayo ekuqaleni. Iy'nhlelo zokuthola imigomo, ama-vaccines ziyasetshenzwa okwamanje, silindele ukuthi ngeke kudlule u-April engafikile, kodwa sikuzama ngoko kusemandleni ukuthi sithole ngaphambi kwalokho. Into eyenza ukuthi kube yingxaki ukuthi kusekhona amanye ama-vaccines angakaqedi ukuhlolwa ekufuna siwalinde ukuthi ngoJanuwari bese sithatha isinqumo sokuthi nakhu okuzosifanela njengeNingizimu Afrika. Kanti amanye amazwe amaningi avele athenga yonke nje into ekhona yama-vaccine. Ngakho-ke sisakulwa-ke lokuthi sikwazi ukuwathola azosilekelela. Uma efika abantu ababalulekile siqale kubona yilaba abangabasebenzi bezempilo nalabo abathintana kakhulu nomphakathi okufanele sonke isikhathi imisebenzi abayenzayo ingaphazamiseki. Bonke labo sibona bebalulekile. Bese kulandela-ke asebekhulile nalabo abanezifo ezinye ekudinga zilashwe, konke lokho kuhlangene. Lokhu bekushiwo-ke kokuthi-ke siyacela ukuthi umphakathi usheshe ubafihle abantu asebesishiyile. Sikushiswa lokho ngoba asifisi ukuthi abantu bagcwale kuze kube nengozi ukuthi labo bantu asebesishiye ngalesi sifo bese bethelela nabanye abantu. Kodwa inkinga yangempela ngomngcwabo yokuthi uma sihlangene sizofihla umuntu siyasondelana kakhulu, sithintane, sibambane, kukhona abakhalayo, kukhona abanjani. Konke lokho siyazi ukuthi kusuke kubuhlungu, kodwa into esiyicelayo yokuthi asisheshe sibabeke kwenzela ungaze kube nokuhlala isikhathi eside, kuyangenwa kuyaphunywa, kuyangenwa kuyaphunywa. Ugcine manje sekuze kwagula abantu okuyibona abala ekhaya. Kwesinye isikhathi ungathola lowo ovele siyomfihla yena ngaleso sikhathi ube senegciwane nje le-COVID, kodwa nalabo abasele mhlambe nabo banalo. Ngakho kovakashayo ukuthi uzobona la ekhaya uzophuma mhlambe sephuma nale gciwane masinganakile. So konke lokho izinto kufanele sizisebenzele sizibheke. Into esikhulumayo-ke yokuthi kulamalanga sithe kukhona abantu esithi babakhiphe ezibhedlela ukuze kuvuleke isikhala salabo abane-COVID, kodwa sinako ukwesabela ukuthi uma singanakile zizonyuka kakhulu iy'namba abantu sebebuyela emakhaya, sebebuyela ey'ndaweni akade abasebenza kuzo uma sekuqala uJanuwari. So lento esiyibonayo njengamanje ikhombisa ukuthi amanani angaphezu kwamanani ebesinawo kade sihlushwa yi-COVID yangoJulayi, kulokho sibona ngathi kuzobeqa kakhulu. Ngakho-ke sithi masibambisane sibe nendlela yokuzivikela kuleso sifo. Yesterday we reported about 1,011,871 cumulative cases and over 7,000 new cases. In this last epidemiological week, we have surpassed the peak of the first wave, and we had indicated that the epidemiological picture would compel us to tighten the restrictions. So those numbers are real. We've seen that they are increasing. The majority of the new cases now are coming from KwaZulu-Natal. In the yesterday's numbers, 30% were from KwaZulu-Natal, and then 29% from Western Cape. In Gauteng, it was 24%, and Eastern Cape was 51%. So the majority of the new cases are coming from those four provinces. The overall positivity for the newly tested individuals is 32.9, with Western Cape at 45%, followed by Limpopo at 41%, KwaZulu-Natal at 36%, and Mpumalanga at 33%. Those numbers are very high, and during the lowest peak, lowest level, we're at around 10%, and so we just want to indicate that this increase in positivity rate is showing us that we have actually a fast-growing epidemic. The positivity rates are therefore a major concern, as we have said that we used to have 10% and less. That's when we were benchmarking to be stable in a plateau. 11,256 patients are currently in hospital, and that number has been increasing literally every day. This is 8.3% of our active cases. Now, of course, of these cases, 3,543 are on oxygen and 604 are on ventilators. According to the resurgence threshold, the majority of districts in South Africa are now in response phase. This means that they are greater than or equal to 20% increase in new COVID-19 cases compared to the 7 days before. So we check every 7 days, how high are you from that previous one? Or they are greater than or equal to a total of 30 cases per 100,000 population in the last 7 days. There must be a minimum of 10 cases per 100,000 in 7 days, and that's how we're calculating this. To determine whether a district or province is a hotspot or in resurgence, in each of the resurgence monitoring indicators were assessed for the following districts, for the following issues in each district or province. We look at the new COVID-19 cases per day. We look at the testing rate per unit population. We look at the percentage positivity rate. We look at active cases, and we look at COVID-19 hospital admissions and COVID-19 mortality and all-cause mortality. The criteria for the provinces or districts for meeting a hotspot are that the province or district must have crossed the response threshold. Those are the numbers I quoted earlier. The resurgence indicators must also support the response classification showing a similar trend. So when all of these other indicators are showing increase, we're looking at that as already being in response mode or or a hotspot. In other words, we don't just do a random definition of hotspots. There's a clear way of how we look at them. So in all those provinces now, all the provinces, we've now instituted our research and plans, which are adapted from the research plan that we developed together with WHO. We're focusing on strengthening on governance and leadership. And that's why you would have seen that in some of the provinces we've actually changed leaders, and we've been there to go and reinforce on the leadership. On medical supplies, we follow as well, particularly to make sure that the medical supplies are not interrupted, particularly oxygen, which is in high use, must be increased, and some of the medication that is needed. And then we have to also look at the issues of port and environmental health for those who are coming into the country and those where we have to do inspections to ensure compliance. Then we have to look at epidemiology and response and facility readiness and case management, information systems, and other issues of occupational health and safety and communications. We have to look at all of those issues together. The safety of our healthcare workers remain our paramount concern. Right now, I was in a meeting where we're discussing with the trade unions on this issue because it's a matter of our major concern. And we're concerned by the rising number of professionals becoming infected with COVID-19 during the second wave. We continue to engage unions and praise them on this plan of our resurgence plan and our response to the health and safety issues. It will greatly assist, therefore, for us as we welcome in a few days 2,367 medical interns. Those are the new ones that are allocated. And then 1,693 medical community service practitioners who are part of a whole team of 7,895 community service workforce from all categories. These are the new employees we're bringing into the system to actually help to deal with this situation. Obviously, every year we have to provide posts for these particular categories. I think it's important to indicate that we have accommodated all that qualify to be accommodated. This will provide also a relief for a number of those who are exhausted. And we also are focusing on the availability of PPEs, which at this point in our day-to-day audit, we check availability is above 87%, which we want to move really up to 100%. Here we're working together with unions on creating what we call occupational health and safety committees. We want to encourage unions to access the dashboard and use the stock visibility system so that they can do the monitoring of the PPEs. At this point, we have actually given access to the government departmental PPE dashboard so that unions don't argue, don't raise an issue in abstract. They go into a hospital and check, and then they say, but here there's a shortage, and we're talking from the same system. This has helped quite a lot. This is important because the number of health workers who are infected has increased, and this will tend to happen each time the community transmission increases. The health worker also get a higher proportion of that because they are part of the community. We're also cognizant of the non-COVID related services that need to continue, and that's why we raised the issue of the alcohol ban, that we need to reduce the impact on our facilities, where we have to actually find that our ICUs are full of trauma patients when in fact we need them for COVID-related situation. And it's going to be very important. When we get time, we can actually share with you the research we do, which shows every time there's a lift of the ban on alcohol, trauma increases in all the outpatient, in all the casualty departments, in all hospitals. And when we want to really deal with the problem of availability of our human resources, our hospitals, and additional equipment, we need to then make sure that we reduce the trauma. And most of it gets just drastically reduced by the suspension of the sale of alcohol. We also need to balance up, because whilst the COVID is putting pressure, we've got other services that need to continue: immunization for children, antenatal care, screening, testing, and for HIV, TB, malaria, and also non-communicable diseases. And all of these are also getting displaced when we've got a problem of COVID upsurge, resurgence like what we've got now. It's therefore important for us to understand that you can't solve this problem from inside the hospital. You can only solve it from the community. When people's behavior changes, when people reduce the transmission, then we are able to manage the patients better in the hospitals. So our request is that all the issues that the president has raised is to help us to reduce the spread of the infection, so that we can open up our hospitals to continue to treat people who would have come there with other diseases that are not related to COVID, because COVID is one problem. It's urgent for now, but the other diseases also do cause illness and death, and therefore we must still be able to cater for people who are coming for other types of problems other than COVID. But now, if there's too much of a COVID transmission in the society, that means everything else must be displaced in the hospitals, and that all we can do is to focus on COVID. And then other people will have a problem of cancer, they'll have the problem of diabetes, heart failure, blood pressures and so on, which are not easily managed simply because the hospitals are now full. But those hospitals can be so full also that if we don't contain the transmission in the community, we may end up with a challenge where the hospitals are not able to cater for all the people that need to come through. At the moment, our hospitals are managing, but we can see that the load has increased quite a bit. We are worried that in the next week the wave is going to be biggest in Gauteng, and again that's a matter of concern for us. So we're increasing on the testing so that people can be separated quickly as to whether they've COVID or not. But people must come and seek assistance so that we can detect early and help to prevent the spread and complications of the infection. At this point, I'd like to hold it at that. I think if there are any questions, we'll be ready to respond. Thank you very much, Minister.
Thank you, Kabazela. We now move to Minister of Police, Ndosi.
Do I commit crime by removing my mask? Velase?
It depends who you are with. If you are alone, you're not committing a crime. But if there are many people next to you, then you are.
Yeah, there are many. So I'm not going to remove my mask there.
But then, Ndosi, there are other people who need to hear your message as well, who can only hear by reading your lips.
So I must commit the crime of removing the mask.
As long as you'll explain to the magistrate why you did it and there was compelling reasons of doing so. Continue, Ndosi.
No,
I think under the circumstances, we must just ask that the others must be at least more than 2 meters away. As Ndosi, I think your point, Minister, is correct about broadcast requirements. So I think that should be fine. But the others must be far enough that they can't be affected.
Oh, they are firing off Minister of Health. No, thanks very much. Our job as a South African police is not to make laws, but is to enforce the laws. Besides what is happening, as the President addressed the nation last night, we had our program as a South African police, where we're dealing with the crime situation that all the time is up during this time of the year. Especially this province in KZN where we are at the moment. There's been a lot of murder around the country. Maritzburg, people were killed. Newcastle, people were killed. And there is just some murder going on. We know that in Eastern Cape, people were killed. So as a South African police, we need to deal with those things, with the safety of the people there, which is our job. The gender-based violence and all, we need to continue to make sure that people of South Africa are safe. But for the fact that the Constitution instructs us to protect and combat, we are part of what is happening. We're part of the instruction of the President. Both Minister Mkhize and Minister Dlamini Zuma have read the things that are not supposed to happen. Ours as the police is to put a fine comb on those things. There are few things that we would really love to put a fine comb on them. The mask thing has been a problem for a very long time. The police have been out there and other people making a plea that people must put their mask, which up to this point has been found to be one of the major preventatives that can be used to prevent these things. So we're glad that now the enforcement has been heightened. We're not just going to tell you or remind you to wear the mask. If you don't, you will be definitely arrested. Well, the situation of arrest is on the schedule here, is on the regulations that it might be a month, up to 6 months, or both fine and 6 months. So I'm sure people are beginning to ask how much will be the fine. We would have loved not to arrest you. We would love to not to fine you. But if you avail yourself, we'll take the opportunity of arresting you. We definitely would not deny that opportunity of arresting you. But if you keep the law, the prisons, the police stations are not empty, but definitely there is your space if you break the law. We would not say we don't have the space. So keep those masks. It has been explained now. How are they kept? The mask all the time in a public space. Keep that mask, failing which you become a client of the South African police to take you, put you in there and charge you. Unfortunately, most of you are going to have criminal records, and you know what criminal records do in your life going forward. So we are shouting, we're making clarion calls, people to respect this, but if we don't, we are going beyond the plea. Now we make sure that there are consequences. That's what we'll do. When it comes to alcohol, well, it has been explained that alcohol cannot be sold anywhere, whether off or on. And Minister Dlamini Zuma explained, no transportation of alcohol, which means wherever alcohol is now, stays there. There is no movement, no bottling, no can of any form of alcohol in your boat, no transportation, no distribution, no taking alcohol from next door to next door. So you will only keep the alcohol where it is at the present moment. So you don't take it from section A to section B to go and enjoy. You will drink the alcohol that you find there. Anything that is transportation, whether you transport it in the boot of your car, whether you transport it in your hands, on your feet, yourself, whether you put it in your head, the alcohol shall not be moved where it is. So you will be arrested on that one. But also, there are people that are causing some economic sabotage when it comes to alcohol, that they open the black market. Our eyes are very much open on that. We are going to be tough, and we really advise very serious that those that have licenses, those that have the permission to trade on alcohol, if they break the law and they sell it illegally, those licenses must be taken and they must be sent to prison. So wait for these 2 weeks. But I would like to warn these 2 weeks. It's not automatically you selling after 2 weeks. It's not automatically going to the beach. The regulation puts it very clear that 2 weeks will be a reviewal. So you'll have to wait for a reviewal and an announcement that will, don't say 2 weeks is over, so you go there. But also, when it comes to the things like beaches, there are many other things that have been mentioned. The rivers, the dams, the lakes, and all that. I'm sure the police will be reasonable enough to allow people to go fetch water, maybe do the washing, those that wash but you shall not use that to go and create your own picnic along the river. It will be clear that this is not washing, this is not fetching the water, and this is a picnic. So that is not allowed. So, as we have said, public places, your parks, your recreational centers, there is no alcohol there. Maybe it's a time to repeat that you will only drink alcohol in your house, in your mother's house, in your father's house, in your own house. Don't take it out there. So as South African police, we will be strict to protect those things. There is one thing that has been raised, Kabazela and Mama Sumo, to say there are people that are walking around knowing very well that they've been identified positive. If people and when people know that information and they give this information, that person is a criminal, must be treated as such, is spreading the death, and it cannot be allowed to do that. So it's important that those people must be reported on different police stations and all that. And I guess we will create besides the 10-111 that the police have, we'll create other platforms where they can phone us to say, we know so and so has been tested positive, but is moving around, is vagabonding around as if nothing has happened. It cannot. That is a serious offense, and that's an offense that we'll have to look after it. And so those are basically are three things that we'll be working on: the mask, the alcohol, and be at the places where you're not supposed to be. The question of curfew, we would usually tell you to go home. Now we're not going to tell you to go home, we'll give you home. So if we find you between 9 p.m. and 6, vagabonding and going out there, we'll make sure that we give you home and you go and greet the magistrate. That might create you a criminal record. That might keep you in prison for a month. That might keep you in prison up to 6 months, or both the fine and prison. So it's important that 1 minute past 9, everybody is in his or her house. We're not supposed to be moving. Especially, we want to urge the young people. We want to urge the young people. There was this narrative to say that they don't suffer on the thing. That has been, that narrative has changed now, and everybody is a victim, everybody is vulnerable, so we need to work together on those matters. The non-sale of alcohol means non-sale of alcohol. Don't put alcohol in your teapots in restaurants. Don't put alcohol in the bottles written zero alcohol, yet you put alcohol there. We know your tricks that you are doing. Don't do that. So don't invite police to come and check if that is a really rooibos or is there something else in the teapot. And if we find that is something different in a teapot, not a tea in a teapot, we will make sure that you lose your license, you lose your permit to trade and all that. So it's important. And we are calling on the industry to respect, to work together with us. Don't give these permits that are weekend permits and all that. That's important. Lastly, which is not a very nice thing to do, which is on the painful side, when we're supposed to deal with the funerals. Funerals have been explained what is supposed to happen. Police shall not hesitate to be part of dismantling the funerals that are illegal. Anything 50, anything 4 hours, anything after party, anything after tears, police will deal seriously with that matter. But having said so, police themselves is a group of human beings themselves who are the front workers, who themselves they suffer. Please help all of us and behave so that we do the work that we're supposed to do to fight crime, rather than to chase people that they know exactly what they're supposed to do, but they don't do. But as I've said, we would love not to arrest anybody when it comes to this, because everybody is cooperating on this one. But akusho lokuthi siyenqena ukukubopha, akusho ukuthi ngeke sikubophe mawuphula umthetho. Sigcina umthetho kwenzela ukuthi sikwazi ukusebenzisana. Okwamanje siyabonga kakhulu Mvelase, sicela ama-South Africans ukuthi le impilo yethu sonke uma siyiphatha kahle sizoba ngcono lesimo, uma singayiphathi kahle sizokwazi ukuthi sigcizelele samaphoyisa sikhuphe ukuthi abantu bayiphathe kahle. Siyabonga.
Thank you, Ndosi. The last minister to speak now before we take questions, Minister Ronald Lamola, do you want to speak? Minister of Justice.
Thank you, Mvelase. No, I think I will only take questions. I think I'm covered.
Thank you. Thank you very much, colleagues, and also all the broadcasters who have created this platform for us to interact with the people in our country. Newsroom Africa, thank you. ENCA, thank you. SABC, thank you. We now open for questions. Nongceba, do we have any questions that we have received?
Yes, Minister, we have quite a number of questions we've received.
Let's get on with it.
All right, thank you. The first question is from Tace Kiba from Platinum Northwest TV and Opera News. The question is, religious places have been considered as essential services. With the new regulations, what is going to happen with indoor religious gatherings? A related question from Faisal Patel from Radio Islam International. The question is, I need clarity on religious gatherings, specifically mosques. Are mosques allowed to open? If yes, what are the protocols? Takira Desai from ETV News is asking, what does the new adjusted level 3 lockdown say about inter-provincial travel? Meaning, are people allowed to travel inter-provincially? And secondly, what are the new regulations saying about private social gatherings? Are those still allowed? He's also asking, he's also asking, how much of a fine could someone face for not wearing a mask? And lastly, there's a question directed from the same person to the Minister of Health. And the question is on PPE stock and nurses. Do we have enough right now? The next question is from Tando Kubeka from EWN. It's directed to the Minister of Health. What are the timelines for the SAPA clearance for the vaccine, given the fact that SAPA can't use the FDA's emergency use clearance to approve a vaccine without its own testing? Secondly, what is the current preferred candidate vaccine? And what effect, if any, does the current herd immunity have, and how many doses of the vaccine will we need? The following question is from Marcus Charles from Cape Argus, and it's directed to the Minister of COGTA. Can the Minister please clarify which businesses are allowed to operate under level 3? Can the Minister also provide clarity regarding the sale of tobacco? Are South Africans allowed to walk their dogs and to go for jogs? And when will the NCCC meet again to review the regulations? Then the next question is from Thomas Litoba from Kasi Voice News. It's directed.
Can we
Yes,
stop
Minister.
before we lose the questions? Let's because we have given us now 5.
Yes, that was 5, Minister. Yes, that's correct.
Given us 5. Why don't we ask colleagues to at least respond to these questions that have been asked up to now? Anyone, colleagues, anyone who wants to start? Minister,
Yeah, I could start.
Yes, ma'am.
In terms of faith gatherings, for 2 weeks, they are not allowed, just for the 2 weeks. All of them are not allowed for the 2 weeks. Inter-Provincial Travel, that one is allowed for now. People can travel between provinces, especially because now some of the people are already out of their homes. They've gone to holidays, so they will need to travel to go back to their homes. So inter-provincial travel is allowed. Social gatherings are not allowed. All of them are not allowed. So I'm not sure when you say private social gatherings are not allowed. So that's, and then businesses that are allowed to operate. I will tell you those that are not allowed to operate because pretty much the economy is still open. So it would be difficult to count everything that is allowed. I'll rather just tell you what is not allowed. Nightclubs are closed. Bars, taverns, shebeens are not allowed. Places, of course, that sell alcohol on site or off site. Yeah, that's really, most businesses are open. So the economy is still open. And then, can you walk dogs and jog? Yes, you can still walk your dog. You can still jog, but not on the beach. If you are in the provinces that are hotspots, you can walk, jog, but not on the beach. Thank you.
Do you want to respond to tobacco, ma'am?
Because I've responded to what is not allowed.
Okay.
If you want specific tobacco, I did not mention it as part of the industries that are not allowed. So it means it is allowed for now. Thank you.
Okay. Minister Zweli, please.
Thank you very much, and thanks for the questions. The first question I'd like to relate to is the one on PPEs. We have made a huge effort to secure PPEs for all our health workers. We have actually put in every facility occupational health and safety committees, which must then discuss at a facility level if there are any challenges with the availability of PPEs. At the moment, the report we have is that the availability of PPEs, as we were auditing, is beyond 87%, which basically covers the facilities that have been already audited. We have the agreement with the unions that they must have a password to the departmental stock visibility system that will be able to detect the movement of PPEs from storage, from supplier to storage to a particular facility, so that they are able to intervene. And if there's any need for intervention, it happens at the facility level, at a district or a provincial level, even up to the minister. So at this point, we take the issue of protection of our staff, both in terms of availability, quality, as well as availability in terms of quantity, as well as the quality of the PPEs in terms of the sizes and the nature of the material used, as very serious to ensure that our workers are protected. We expect that if there should be any problem, the staff should be able to raise the issue immediately, and these systems must respond so that we are able to deal with any shortages. The supplies across all the departments, all the provinces, they have indicated that they are so far quite satisfied that they don't have a problem. So we will continue to monitor it, but from where we sit, we believe that that matter has been given adequate attention. The second issue relates to the SAPRA and the new and the vaccine registration. The SAPRA runs its own independent mechanism for registering vaccines and any other products, and some of the manufacturers have already submitted to SAPRA for purposes of registration. And they've got a system which they've put up with a team to fast track the movement of the applications. And that process allows the producer to submit information as it comes, so that it can be looked at, as the information is being submitted, which will shorten the time it will take to ultimately provide the approval. So all the various applicants are aware of this process, and the SAPRA is actually expediting the whole process of registration. So we believe that on all of them, we've got a fast-track mechanism that will give us early registration without compromising the quality and the processes that are involved. So from the point of view of timelines, it depends as to when someone would have put in and what information is available, but we are quite comfortable and convinced that the work between SAPRA and ministerial advisory committees and all the research institutions, we are all in sync that there should be an early registration of any vaccine that gets tabled to SAPRA. The fact that the vaccine would have been already registered in other jurisdictions adds quite a lot, although it's not the only thing, but it's a very, very important issue, because all that SAPRA will do is to collect all of the information that was approved, to look through it. If that information is standard and therefore, and is available, then of course it makes the processing much easier. So that would be the one question. Which vaccines are preferred? At the moment, you have about 11 vaccines that are being, which are being processed by various countries, which we're all looking at. They are all being evaluated in the same way, and we believe that what really those that have got the results out and they have shown the finality in terms of the efficacy reports, those will actually be standardized, because it's the same science across different countries. So once those are finalized, then it becomes important to say they could also be accessible to us if we decide to take those. What we are looking at is that which vaccine has got good efficacy and is available, and is it affordable, and so on. So we are looking at those factors, and if you put all of those factors together, you will then notice that it will be a matter of which one is available. You might find that a particular vaccine is cheap, is easy to administer, easy logistics, and affordable, but it's not available yet. And yet we want to try and get some vaccines now. So that then goes to the back of the queue until it's available. Then you find one that might be expensive with different logistical issues. We might then say, well, we now are needing to procure this vaccine. It's the only one that's available. The others might say, yes, it's there, but we've got orders that we are not able to satisfy. So from that point of view, we're not able to give you the vaccine that you're looking for. So you go for the next best available in terms of your preference, in terms of the issues of cost, in terms of logistics, in terms of all of those issues. So all of them are being evaluated. So once you get to the point of procurement, we'll pick the one that would be most available at that time, because the issues of technical efficacy and safety would have been established. The last question is around the herd immunity. Generally, the theory on herd immunity indicates that any person who's been exposed to the infection would develop immunity antibodies that will make the person to be not susceptible to an infection if the same pathogen came to infect them. Now, there are a number of unanswered questions about the immunity. Some of the immunity can be permanent. That is, from once you get exposed, your body develops this and keeps memory in some of the cells, which they call memory T cells, which allow the body to respond when something that they've developed antibodies before is available, it's now entering the blood, the human body. So that, depending on the type of pathogen, you might find that the immunity can last longer. In some cases, the immunity might not be adequate. It might be there, but not good enough. In some cases, it may be adequate for a period and then wanes off at a certain time. So we don't know all of those issues. So when the vaccination program starts, then there will also be a way of assessing on those people who have been exposed, whether in fact they need to be given the vaccine or not. It's still early days because it's a new vaccine. Some of those questions are not very clear yet. Thank you very much.
Thank you, Kabazela. Minister Lamola?
Thank you very much, Velase. With regards to how much will be the fine be on the issue of the penalty for the offense of failing to wear a mask, in terms of the Disaster Management Act, you can either be fined or you can be imprisoned, not exceeding 6 months. So the fine is determined by the magistrates, and we will leave it to their guidance in that regard. It is within their jurisdiction. So what they usually do, which is what they are currently undertaking, they usually give each other guidance so that there should be uniformity through the chief magistrates countrywide in terms of the type of fine. Since we have started with the Disaster Management Act, there was a point where there could be different type of imposition of fines for almost the same offense. But they've now developed guidelines which are guiding themselves in terms of what then becomes the appropriate penalty or fine for any offense falling within the Disaster Management Act. So they are currently engaged in that process, and I think soon there will be clear guidance in terms of what they will impose for that particular offense. And that will further also be influenced by the inputs from the various role players in the criminal justice cluster, which is the National Prosecuting Authority, and also the South African Police Service. So there is no exact amount that we can say this will be the amount. They will be able to determine based on the facts and the merits of the matter, and then they will be able to say, for this, we could put an amount of of this much, and that will be through the processes of the courts. With regards to the second one, of the time period for the social gatherings that were asked, and the act, and the period of the state of disaster is up until the 15th of January. And if there is any review in terms of the regulations, in terms of that, it was said that it could be reviewed maybe on the 10th of January. But if there is no review or anything, it will have to go up until the 15th. And all indications are that with the epidemiological reports that is coming from health, we may have to again extend the state of disaster. But in terms of which regulations will be applicable and so forth, it will be announced as and when there is a review. At the current stage, what is applicable, it is what has been gazetted. Thank you.
Thank you very much. Nangabale, let's go back to you. Unless, Doso, you want to say something, but maybe let's wait for the next round.
Thank.
Dosi, you wanted to say something, Dosi?
No, Minister Lamula has answered on the first question, how much. I'll leave with that. But I'll remind the person who asked that question that you have a better way of not seeking the fine by wearing the mask. It might end up 6 months rather than the fine. So don't come close to it. But for now, the police, under regulation, they are giving something called J534, which could be the police fine that they make you choose whether you want a fine under a J534 or you want to go to court, of the process that has been already explained by Minister Lamula. So we'll leave it there. Exactly how much, it might be 6 months. So don't come to temptations to say you want to feel how long it will be or how much it will be. It might be 6 months, not just a fine. Thanks.
Nangaba, can we then hear the other questions?
Yes, Minister. The next question is from Thomas Litoba from Kasi Voice News. It's directed to the Minister of Cocta. The question is, why did government give Controlesa permission to allow initiation schools to operate when COVID-19 was still strong in the Eastern Cape as well as other parts of South Africa? And clarity on traditional ceremonies. So outside of Imigidi, Imicimbi, will those be allowed to continue, although public gatherings have been restricted, or are those also prohibited? Betty from Channels TV Lagos is asking, some international flights will arrive around curfew time. How will passengers be affected when they arrive? And if we can also just get clarity on international travel, whether that is allowed to continue or not. Sophie Mukwena from SABC is asking, is government engaging those countries that have imposed travel restrictions on South Africa? And Natasha Puri from the SABC is also asking, the non-wearing of masks has now been declared as a criminal offense, but how will government ensure that that is properly enforced? The last question for this round is also related to the issue of masks and enforcement. It's from Corinne Duplessis from News 24. Please clarify at what point not wearing a mask is an offense. According to the regulations, it only becomes an offense if you refuse to put on a mask after being told to do so by an enforcement officer. Please clarify what that means. Also, what will be enforced in restaurants, and how will this be enforced in restaurants? For an example, when people are waiting for their food or finished eating. She's also asking what exactly is meant by rigorous exercise in the regulations. What is the legal definition in terms of heart rate? In some gyms, people are allowed to do non-cardio exercises like yoga and Pilates without masks, even though those don't raise the heart rate that much. The Minister of Sports was supposed to issue regulations with a definition in this regard, but there has been no such. And lastly, from the question, the last question from Corinne is, why is the curfew until 6 a.m. when it is already light by 5 a.m.? Does this have something to do with the ease of enforcement? I'll end there for now, Minister. Thank you.
Thank you very much. Initiations, Minister Dlamini-Zuma.
Thank you very much. There was a strong presentation from the government, from the provincial government of the Eastern Cape, from traditional leaders, from many people. There were consultations with health, with government as a whole, and there were very strict protocols that were put in place. The Eastern Cape government, working with traditional leaders and other stakeholders, had to produce a plan for the Minister of Health to be satisfied that the health protocols will be adhered to. And immediately after the ceremony was not allowed, in the hotspots, it was not allowed. At the time this happened, the numbers were not what they are. It is for that reason that now that the numbers are rising, government has taken a decision that all initiation must stop. They were only allowed in the Eastern Cape because Eastern Cape had produced a plan to satisfy that the protocols will be adhered to. But now it has been stopped. Now it has been stopped because clearly the situation has changed. Only those that are already in the initiation school will just finish, but otherwise it will not be, it's no longer allowed. Those were the reasons and the circumstances. The curfew, I don't think it's necessarily about darkness. The curfew is about trying to limit movement of people. So that's why it has been extended, because the movement of people is the one, that
thank you.
The one that takes, yeah, my network sometimes falters, sorry. The movement of people is what moves the virus. So the curfew is about limiting the movement of people. It's not necessarily linked to darkness. So that's what I could say. International travel is allowed. Nothing has changed, except for those countries that are not allowing South Africans or are not wanting to travel to South Africa. But in terms of the South African regulations, people can still travel internationally, and international travelers can still come to South Africa if they keep to the protocols, like having a certificate that is not older than 72 hours, and so on and so on. And of course, DECO and other relevant departments are engaging with the countries that have stopped South Africa, the traveling to and from South Africa. For now, that's what I can say. The regulation about the masks really shows that you're not trying to get people to prison, but people must make sure that they are wearing their masks. and the police will do what it needs to do. So I don't know why people are asking so many questions, because what is needed is for people to wear a mask. And then all these things will fall away, whether it's fine or prison or what. If you're wearing your mask, the police won't bother you. You won't have to answer all these questions. So please, siyacela nje ukuthi abantu bagqoke ama-mask, bagqoka ifonyo, ukuze bangahluphani namaphoyisa, amaphoyisa angabathinta, angabahluphi, ukuze bangaze bafanele ukuthi bazi ukuthi fine imalini. Mawuzigqokela imask yakho, awungeni ndawo kwi-fine, awungeni ndawo ejele. Gqoka imask ukuze uziphephise, uphephise nabanye abantu. Ngiyabonga Minister Mthembu. I think the enforcement, there are people who can answer that more than I can. Thank you.
Any colleague want to come in? Kabazela.
Just a brief one about the definition of a rigorous exercise. I don't think it's necessary for us to go to that kind of definition. The idea is it's a provision to allow ease of breathing when someone is doing an exercise. And this is just to make sure that WHO designed this just to cater for a situation where someone might feel that the increased demand on air, which is imposed by the excessive breathing during the exercise, may result in them feeling that there's a bit of syncopal feeling or dizziness as a result of that. So it's a precaution, it's a health precaution. It's not about someone will ask what's your pulse rate and so on. If someone is doing exercise and is feeling that they need to open the mask because they need excessive breathing and extra, activities, then that's the provision. That's what it is. So it's a precaution. It's not a tricky definition. It's really to say if you're exercising, and everyone knows who's exercising, that when we say vigorous, it's because you can walk with a mask, and that be considered an exercise which is not strenuous, and you can do so. Many people walk with a mask, it's not a problem. But you can actually be doing something a little bit more active that might require that you must open the mask. Once you are done, then you can go back and use your mask. So that's how we're looking at it. Thank you.
Velas,
Dos.
umama uNkosazana uphendule kahle le. Abantu abangawalingi amadlozi ngalezi fonyo lezi. Ngoba kunembuzo ekhombisa ukuthi bafuna ukulinga amadlozi babheke ukuthi kwenzekani. Abangawalingi abafake ifonyo akhopho isezosondela eduze kwakho. Kodwa kunombuzo uqondile ukuthi siyagreminder noma sikwenzani. Yebo siyagreminder, asifuni ukugcwalisa amajele. Into eyenzekile ngaphambili ukuthi umuntu umkhumbuza ukuthi afake isifonyo, abuze ukuthi uzongenzani uma ngasifaka. Lo mbuzo uvelile kaningi ikhatheni, nawusekho-ke lo mbuzo manje ukuthi uzongenzani. Uma kuthiwa afake isifonyo, sifake, ungawubuza umbuzo ukuthi uzongenzani, ngoba uzolala ubaliwe uma ukuthi awuqhubeka nokungasifaki isifonyo. So asihlukane nokubuza ukuthi uma ungasifaki isifonyo kuzokwenzekani. Akungabi khona ukuzolandela ngoba wonke umuntu usifakile isifonyo. So it's what we're putting on the table. Put your mask, there is no trouble. People used to ask us, what are you going to do if I don't put my mask? And the person will literally take the mask off in front of you and nothing you could do. Those days are gone. Don't take the mask when we remind you, because we don't want to fill prisons. No, that's a population we don't want. But if you want to be part of the population, we tell you to put on your mask. You don't put on your mask. Now the law allows us to go beyond telling you. So that's what will happen. Please put on your mask and spare the police out of your sight. Thank you.
Lamola.
Yeah, Velase, I have got a troublesome person here, but let me try. I only want to answer the one of international travelers who arrive during the period of the curfew. They will still be allowed to reach their destination. Thank you.
Thank you very much. I don't know whether there's any of our colleagues.
Maybe just to add to that one, if they can show that they were traveling, they can show the stamp of their
Ticket.
or of their ticket or their passport with a stamp that they've been traveling, the police will leave them alone. Thank you.
There was a question, I don't know whether anyone wants to respond to the travel restrictions that have been imposed on South Africa by other countries. Any colleague who wants to venture on that question? Kabazera.
Vanessa, I'm not answering that one. There is a question that is hanging off the testing of the wine. Some people are asking if they're going to still taste the wine. No, it's prohibited now. It has been allowed where it comes from, but there is no testing of wine now. It's a question that many people thought they can continue to test the wine, not under present conditions. Thanks.
Kabazela.
We have not contacted all those countries that have imposed a travel ban. We are going to engage some of the ministers, particularly in the UK, just to discuss their approach on the matter. However, we noticed that these strains are appearing in many countries. As I was sitting here, we have seen there was a report around Japan, but we also had there's a report around another one emerging in Brazil. Some of them might be related to the variants we're seeing in South Africa. Some already, about 10 countries were said to be having the same strain in as in the UK. Our sense is that from our scientists that the strains, the variants are likely to arise in different countries, even if they're unrelated, because it's the same virus that's got a tendency to break into some kind of mutation. And so we hope that with time, we will be able to get a general approach. What we are going to also do is to engage WHO just to be able to get a further sense of how we would deal with these issues across the different countries, because from what we can see, there might be an initial response now, but the level of these variants being detected is not the same in different countries. And some instances it would happen that they may not even notice it until they collaborate with various other countries, in which case, therefore, I think that a discussion at that level will be guided by new information that arises about the variant. If there is no major problem that's associated with the variant, we would be able to make a case that, in fact, it may not be absolutely necessary to do what has been done by these other countries. But what countries do about their own safety, you can't actually stop them. We have, at some point, stopped people coming from various countries. They didn't come to raise that and complain to us. It was our decision. So it's a very limited area of what can be done. But in terms of engagements on approaching the matter, it's something that we can raise and discuss at that level. Thank you very much.
Thank you. Ministers, we will now take the last round, which will then make the totality of questions to be 15. I know that we have got so many questions. We will send them to our ministers, to the relevant ministers, because we can't be sitting here forever. Now, Nonqeba gave us the last 5 questions, and make sure that those questions that we have not put before our colleagues are sent to them so that they respond to those that would have asked the questions.
Thank you, Minister. I'll just touch on those that haven't been responded to. John Fraser from ZA Confidential is asking, will the TERS and other relief mechanisms be extended given that we are now at level 3. And then another question is, do journalists now need new permits? Please provide details on these permits in terms of how they should be drafted and what other documentation they need to move around. There's a question from Barry Baton from ENCA, directed to the Minister of Police. Has SABC put in any request to the SANDF for support, as was provided for before, or are the police satisfied that they have the resources to enforce the heightened regulations? Then another question for the Minister of Police. Can South Africans be assured that they will not be subjected to police brutality when it comes to enforcing the law of wearing masks? As in, will police immediately make an arrest, or will they first be verbally instructed? And then there's a question for the Minister of Health. From Janice Roberts from Money Making Media 24. Given the lag in the progression of the disease from infection to symptoms and then through to ICU to morbidity, can there be any credible hope that the data will look better on the 15th of January? Thank you, Minister.
Okay. Who starts? Is the extension of the... Oh, okay, Kabaza.
Well, thank you very much, Minister. It's a simple question. We're doing everything to improve the data on a continuous basis, and we will obviously be extending the data to cover literally more facilities so that we can continue to improve the reach of the data that we've got. But at the moment, the data we have is sufficient, one, to inform the country of the numbers of tests that have been done, the numbers of people who are hospitalized, numbers of people who have passed, because we use both the hospital records of death as well as the Medical Research Council reports on excess deaths. And if you put those two together, gives you a sense as to where things are. And so in general terms, we believe that there would not be a big issue that relates to the problem of the quality of the data at the moment. But however, we would accept that there's room for continuous improvement at that level. This lag that we're talking about is natural in relation to the infection. From exposure, you wait a number of days before someone else develops symptoms, and those symptoms will be a number of days before the manifestation of a severe illness. It depends on the numbers of people who are infected, because it's a particular percentage that gets affected. Now, it depends on the level of exposure people have as to how many people ultimately get infected. So all of those things are variables which are part of a data collection process, which we have to always take into account. So I don't think we should be raising any doubt about any of our figures. Certainly, if there's any error that is detected, we then tend to correct it as soon as we detect it. But that's the nature of dealing with numbers. Sometimes there will be errors here and there. For example, when we looked at the reports of in Gauteng, we've had to send a team to go and make sure that the data collection and the quality of data is up to standard. With the same thing in the Eastern Cape, we've also had similar discussions with the Western Cape. So it's something that will, if we detect anything, we'll respond at the time, but we must trust that the data we have is the best that is possible at the moment. Thank you.
Thank you, Kabazela. SAPS, SANDF, Dose.
Thank you.
As well.
Thanks, Umvelase. The second question, the brutality about the police. Brutality is not part of policing, but the part of policing is in enforcement. So it's important to separate those two things. Enforcement we're instructed by the constitution of the land that part of our work is to enforce the law. So we will work hard that no brutality. That is why that there are mechanisms of checking if the brutality has been applied in doing the law. But there are things that you do extra than telling the people to disperse, like asking them to disperse when they don't. For instance, the question of PE, where people, they closed the road, they opened the party, they put the fires, they bought the meat, they bought the alcohol, and they closed the national road. When police came to tell them to go, and they threw the empty bottles and the fires to the police. Police used what is within the law to use, like your water can, like your tear gas. So that can't be a brutality. That is within the law for the police. So we'll urge people not to push the police to reach the level where they'll have to use an extra things within the law. But if it needs be, we'll enforce the law. So we're calling on South Africans to respond on the first call to move. So that's what we'll do. We will enforce the law minus brutality. The second one, yes, this morning I spoke to the Minister of Defense, and after this, South African Police Generals will have our meeting. It might not be on the same scale as Berry as us. It might not be on the same scale, but where police feel a need that they need the extra assistance, that shall be done. Already those talks are between the head of the South African National Defence Force Operations and the acting National Commissioner at the present moment, and the ministers are talking about it. So that is on the cards as we speak. Thank you very much.
Thank you very much, Ndosi. I wonder if there's any colleague who want to speak on the TERS, those that have been party to those discussions. I know it's normally the Minister of Labour, but to the best of our knowledge, the TERS was not extended. The only grant that was extended was the 350 to January. But for people that are out of employment and assisting employers under these difficult circumstances, that continued up to and until October. So there was no indication of any extension from government. And unless colleagues want to bring some more clarity. Mam Nkosazana, do you want to come in there?
No, I think you have answered correctly. I don't need to add anything, but maybe I could come in on the permits.
Yeah.
I think everyone who will be out during the curfew time needs a permit. The employers do give their employees permits. There is a form that has been used, the Form 7, which was used even before yesterday because the curfew was already there. That form can be used, but the employers know that if their employees need to be out during curfew time, they do give them permits. Thank you.
You are very correct, Mam Nkosazana. Even journalists know, because it's not the first time that we are in this situation. Journalists know that they need to get permits from their employers that are duly signed by a recognized leader in their employment. So journalists, you should know that if you are to be out to cover stories and wherever in our country, you need that permit. If you are to go beyond the curfew, indeed, you will not be allowed to pass through the roadblocks if you don't have that permit that comes from your employer, as Mam Nkosazana has said. So again, nothing has changed as it relates to who grants permits, even in churches. People who grants permits are the leaders of our churches. who will grant permits for their congregation to meet at a particular time. And we know these leaders, and they are duly authorized by our regulations, by the way, to issue those permits. So that answers the question on permits. TERS, as we have said, we were able to assist employers and employees until around October, and there is no TERS now. There is no extension of TERS. Already we have responded on the SAPS, SANDF, and SAPS as it relates to brutality. That then brings us to the end of interaction. Lamula.
No, on permits, we request that public representatives get their permits, because there have been several clashes between public representatives and the police when they try to explain. I think they must have something that shows that they are public representatives, so that you reduce any form of conflict on the roadblocks and when the police are implementing the rules. So we request that all people that are responsible for public representatives, your councillors, your MPs and all, they do so that they make life easy for both of them, the public representatives and the police. Thank you.
Lamola?
Thank you, Velas. I just wanted, I see the social media is demanding that I show them who is troubling me here, the deputy minister. So thank you. I've got nothing more to add. Thank you.
Okay. Thank you very much. That then brings us to the end of this interaction with our media. Again, let's extend our thanks to all our broadcasters, Newsroom Africa, ENCA, the SABC. We would not have been able to reach out to our people in the entirety of the country if you did not give us access to your platform. We really are grateful to you. But also we're grateful to South Africans for listening to us. I've received so many messages of South Africans who were listening to this broadcast, who appreciate the information that we're giving more details to what the president announced to the nation last night. With that said, my colleagues, Mam Kosazana, Ndosi, Lamula, Kabazela, thank you very much for again making yourselves available to keep our people informed on what government is doing, particularly as we all put our heads together to fight the spread of COVID-19. Most appreciated. With that said, this press briefing has now come to an end. Thank you very much, colleagues. Thank you to all media personalities, to all journalists. Thank you very much. Siyabulela. Enkosi.